Good evening, you're watching a special edition of The Big Story. I'm Dylan Ang. News just in, about 2 weeks into Phase 2 of Singapore's safe reopening, the multi-ministry task force said today that the COVID-19 situation here is stable and under control. This comes even as the number of community cases has increased from about 4 new cases per day in the week to about 8 new cases per day in the past week. But the task force added that it will cast the net wider around every COVID-19 case to identify every close contact to stem the spread of the virus.
This is not unexpected as more activities resume and the number of interactions increases. A similar trend can be observed in many other countries that have exited from lockdowns and lifted restrictions. Amongst the community cases in the past 2 weeks, the majority were picked up from our active surveillance and screening. On the whole, the incidence rate for the community cases remain low. Nevertheless, the multi-ministry task force is closely monitoring the numbers. We want to detect cases early so that we can ring-fence them and prevent large clusters from forming.
Despite having enhanced testing and tracing capabilities, the task force urged the public not to let their guard down and called on everyone to stay vigilant. Meanwhile, residents of 58 households in an HDB block in Tampines are being tested for COVID-19. They reside in the same section as a confirmed case, sharing a common lift lobby and stairwell in Block 111 Tampines Street 11. Aside from the usual quarantine measures, all 58 households were contacted to see if they are well, given the possibility that they may have been inadvertent contact between the households. COVID-19 testing was offered to those in the 58 households and their visitors. All in, 160 were offered testing. Of these, 58 people were swabbed yesterday, and all tested negative. Another 29 are expected to be tested over the next 2 days.
So that's the new way of operating in this phase. Because of our increased capabilities in testing and tracing, Singaporeans and residents here should expect that potentially more people will be notified whenever there is a case. More people may be asked to go for testing. More people may be quarantined because we are casting a wider net around every single infected case in order to more effectively ring-fence and isolate the virus and stop it from spreading to other people.
With over 14,000 reported cases, the multi-ministry task force also touched on the dengue outbreak here, but said that the situation remains under control. Director of Medical Services Kenneth Mark noted that Singapore is experiencing 2 outbreaks at the same time, but so far the dengue situation is not putting a strain on hospital capacity.
Indeed, our doctors are on the alert and lookout for dengue. We already know that we are having a dengue outbreak amidst the COVID outbreak we have, and that complicates matters for our doctors because they have to distinguish between a fever that presents in a patient with COVID-19 infection versus a fever from dengue. And indeed, in many of these patients where it is not possible clinically to make that distinction on the basis of clinical symptoms and signs, the patients will be tested for both dengue and COVID to make sure that they are not missing one or the other infection.
You can visit straitstimes.com for more stories from today's press conference. You can also watch the full conference on our YouTube channel. Subscribe by hitting the red button below. I'm Dylan Ang. Thanks for watching.